in the beginning?
Greetings and welcome to the United States Transhumanist Party Virtual Enlightenment Salon. My name is Gennady Stoliarov II, and I am the chairman of the U.S. Transhumanist Party. Here we hold conversations with some of the world's leading thinkers in longevity, science, technology, philosophy, and politics. Like the philosophers of the Age of Enlightenment, we aim to connect every field of human endeavor and arrive at new insights to achieve longer lives, greater rationality, and the progress of our civilization. Greetings, ladies and gentlemen, and welcome to our U.S. Transhumanist Party Virtual Enlightenment Salon of Sunday, March 2nd, 2025. Today, we will have a fascinating conversation in store for you about stem cell therapies and what they're capable of accomplishing today, as well as where this field is poised to progress in the future. Joining us is our distinguished panel of U.S. Transhumanist Party officers, members, allies, including our Director of Visual Art, Art Ramon Garcia, our member from Texas who leads the Texas Transhumanist Party, Alan Crawley, our friend Zach Varkaris, who leads Austin Biotech, and our special guest today is William F. Joyce, PA. He hails from Odin Stem Cells, and he is here to tell us what we would like to know about stem cell therapies. So welcome, William. We're very pleased to have you with us today. Please tell us a bit about yourself, about the work of Odin Stem Cells, and what stem cell therapies are able to achieve today, as well as what you think they will be able to achieve in the years to come.
Absolutely. Thank you for having me, first of all. So a little bit about Odin. I'm not sure if the panelists or the audience today knows about Odin, the ancient Norse god. So he's the son of Thor. He's the father of Thor. He's associated with wisdom, war, and magic. So Odin valued wisdom so much that he actually sacrificed his left eye to achieve it. So wisdom, hopefully I can impart some of that today on behalf of Odin Stem Cells. War at Odin Stem Cells, and myself personally, we consider ourselves at war with conventional medicine, possibly even FDA, but specifically the influences on modern medicine and human well-being of big pharma. And then of course magic, because who doesn't need a little magic? Odin Stem Cells was founded by three friends and entrepreneurs, Nicholas Seedsman, Dr. Chase Gant, and Alex Marutka. So a little bit about me. My name, again, is William Joyce. I'm a physician assistant. I'm broadcasting today from sunny South Florida, and I've been a physician assistant in conventional medicine, practicing medicine for 27 years. I'm a graduate of the Jefferson University School of Medicine in Philadelphia, where I'm originally from. I was lucky enough that I was able to get an opportunity to jump onto the regenerative medicine side, which is what we're talking about today: stem cells and their exosomes and what they can do for health and helping the body to heal itself. So that's ongoing for the last 8 years. In that 8 years, I originally started off with doing orthopedic injections because stem cells are, very effective, for cartilage repair. There's athletic injuries, anything with cartilage and muscle, soft tissue as well. So I did that initially, and then really things started to take off out of the orthopedic realm for me and Odin around the time of COVID, right? So around COVID, I started to probably 2023. So I think it was COVID 2.5 or 3 at that time. I lost track. I myself have had COVID for 4 times, luckily never long haulers. And I will tell you that around that time, I started using exosomes and mesenchymal stem cells via IV to treat my clients that were suffering from COVID long haulers and post-COVID syndrome. All of them, like literally 100%, which I typically don't like to say regarding medicine, and not many people will. But I will tell you, with COVID long haulers and post-vax syndrome, stem cell therapy and exosomes it is a cure, period. So a little bit about what stem cells are not, okay? There's a lot of myths about stem cells, a lot of misconceptions that actually affect people's lives, right? So they don't think they can get it. They think it's illegal in the United States. So what stem cells are not? They are not illegal in the United States. They never have been. Stem cells, if we're talking about multipotent stem cells, which is the topic that I will be discussing today, do not cause cancer. People think that stem cells are only available in Central America, South America, and Mexico. That also is a myth. Stem cells do not preclude someone from donating blood in the future. They do not cause infection. They are not magic. Stem cells don't cure anything except, like I said, COVID long haulers from personal experience. And stem cells will not heal everything. So they're not some magical biological thing that that can heal everything and heal mankind. However, what they are very powerful in doing is helping our bodies heal themselves by the use of the stem cells and their exosomes. And I'm going to tell you in a minute what the exosomes really are and what they do. So these are harvested from post-live birth umbilical cords and exosomes from placental source. So these are umbilical source stem cells. The important thing about that is, one, there's no life lost or interrupted when you obviously procure the cells and the samples from post-birth. The other thing is that these cells are considered by your body to be immune privileged. So because there's no longer a transfer, or was never a transfer between that baby who's already born and the remaining tissue that's there, your body does not spark any type of reaction. There are no records of allergic reaction or anaphylaxis. Those stem cells, being immune privileged, can slip right into your body. Your T cells and your immune system do not see them as foreign. So therefore, they're free to do what Mother Nature intended them to do. And what Mother Nature intended them to do really was two things. So one was to make a human, right? So the very first stem cell is that zygote, at conception. So sperm meets egg. At conception, that's stem cell number one. So those cells will replicate until they actually, make that human. Once that baby is born and now it's living life, the second thing that stem cells are designed to do is to sustain that human, repair that human, and regenerate that human. So quite fascinating stuff. It is not old. It is not something new. It is not something that's hidden. But the general public still really are not educated on it, because conventional medicine tends to think with blinders on. I mean, I will tell you myself, I was never taught about stem cells or exosomes, period, in school. Many of my colleagues, in conventional medicine today, specialists and primary care, they have no idea, or they think it's some alchemy of some wizard somewhere. They will routinely discourage their clients from even attempting to, or even talk about stem cells. So that's a challenge. And like I said, since people think that in the U.S. it's largely illegal, we see many of our clients that actually go to Mexico, they go to Colombia, they go to Central America. But that's not necessary. You don't need to leave the comfort of the U.S. to get treatment at all. So a lot of misconceptions. I did say cure. So stem cells do not cure anything, but as close to a cure as we get is COVID long haulers and post-vax syndrome. What happens with COVID, or what happened with COVID that, of course, none of us knew during the pandemic? Quite frankly, science or general public, as we know, didn't know anything about COVID. There's lots of stories, lots of theories. Either way, the virus infects the person, and of course, viruses stay with the body. However, once you've recovered from COVID or think you recovered, there are typically subsequent reinfections. And then once you recover again, there's a great danger that over time, and not very long after a COVID infection, where you start to develop the long haulers. So some of the signs and symptoms of long haulers are all over the place. So it could be a vision issue that you've never had before. We all know about the loss of taste and sometimes hearing as well. People that were previously healthy, just like post-vaccine syndrome, having heart attacks, no predisposition whatsoever, muscle aches, joint aches, so fatigue. People didn't know what was going on. Their clinicians didn't know what was going on because, of course, it was new. Over time, we realized that this is what was going on. That latent virus in our system actually caused an immune response and a total body inflammation, right? So that's why it would affect any body system, many body systems, simultaneous body systems. So it was quite devastating to the client, and modern medicine really had no clue. Unfortunately, clients that do not find remedies in modern medicine are labeled by modern medicine. So they're giving Prozac, they're giving Effexor, like there has to be something wrong with them because we can't find anything wrong with them. Or your blood work's totally normal. Call us in 6 months, see what's happening. So these clients would bounce around from specialist to specialist, ER visits, sometimes hospitalizations, and never get an answer. So when you look outside of the box of conventional medicine and big pharma, you're able to open yourself up to the possibilities that you can then heal many, many more people that also feel the same way, that are disenfranchised from what they've experienced. One example, right? So chronic disease such as diabetes, type 1 and type 2. I personally don't have diabetes, but since 1998, I've treated many diabetics because unless you're a radiologist, there's no way you're not treating diabetes in the general population. So these clients, they suffer, right, their entire life, some as juveniles all the way to adulthood, and some as late onset or type 2 diabetes. There's nothing that has really come out in a development of any kind of cure. Well, certainly there's no cure for diabetes. And I'm not going to tell you today that stem cells are a cure for that. However, those same clients have been using basically the same treatment that I did in 1998 here in 2025. That's discouraging. There's a whole population of people in the diabetic community, and of course in many other autoimmune communities, that are just frustrated. They've been to the specialist, they've spent their copay, they get no answers whatsoever. They've spent thousands of dollars, if not hundreds of thousands, on hospitalizations or conventional blood work, and just getting no answers. So the answer I found, and that was from an ongoing study at the University of Florida that started in 2022. It was head by Dr. Ian White, formerly of Neobiosis. And what that study was using exosomes, pure exosomes, not even the mesenchymal cells, just the exosome alone via IV infusion. Many of my clients, actually every client I treated for post-COVID syndrome, long haulers or post-vax syndrome, it was one vial, so 5 cc of exosomes via IV. And within 3 to 10 days, they felt 100% better. And then any residual complaints that they had were gone universally by a month and a half. So that's how powerful stem cells and exosomes can be. So was there any questions now? I have plenty of things to go over. I don't know if the panel has any questions right now.
I think what you've said so far is fascinating. And I do have a follow-up question on treatments for long COVID, because the results you describe are quite impressive. And of course, there are different varieties of long COVID as well. As you mentioned, the symptoms vary dramatically for different individuals. I myself had long COVID for a year between August 2022 and August 2023. And for me, I didn't have the fatigue issues or the taste or smell issues, but I had these cardiac-like symptoms, even though my heart was structurally fine and the cardiac MRI showed it hadn't been damaged. And the way I got myself out of that condition, actually with the help of people like Zach, who offered very useful advice, was through essentially a graded exercise regimen where I reconditioned my body to feel normal when I was running and engaging in other physical activity. But it took some time. So I'm curious if stem cell treatments, if the exosomes that you describe are able to achieve results much more rapidly, how do you think that happens? What do you think is the mechanism of action? And what are the differences by type of long COVID symptoms? Like if you see people with one type of symptom, do you administer the exosomes in a particular way? If you see people with another type of symptom, do you administer them in a different way to treat that particular manifestation of long COVID?
Yeah, great question. And thank you for your comments. Actually, and surprisingly to both myself and probably to the panel after I answer this, regardless of the signs or symptoms or type of post-COVID, the treatment is the same. It's actually universal. So I would still be using an infusion of exosomes in any client that had symptoms such as yourself, or chronic joint pain, or unexplained fatigue, and with no etiology, from conventional medicine whatsoever. So it's treated the exact same way, and the outcomes are identical. Now, the reason the exosomes are able to do this, let me just tell you a little bit about exosomes. So exosomes are the nanoparticles that are within the mesenchymal stem cell. So these are, first off, we have our own stem cells. That's fine. You can get your own stem cells. You can use your own stem cells. That's considered autologous, meaning from one human back to that same human. But we're not doing that. We're talking about our one stem cells. And the reason we're using our one is because we know that at birth is the highest concentration of stem cells and exosomes versus human plasma in the entire life cycle. So someone like myself, I'm 62. We also know that at 60, just about everyone has lost 70% or so of their stem cells. But that isn't a disease. That's just the aging process, right? So what happens is, as we age, our need goes up, but at the same time, our needs going up from aging and or disease, our supply is going down. So by using the youngest possible stem cells, like I mentioned, let's say hour old, those stem cells are actually giving that client a boost. Now, it's not going to turn back chronological age, right? And it's not going to turn back solar aging. However, it can and does turn back on environmental aging. So everyone on this panel, everyone listening today, including myself, we all are subjects of environmental aging. So that is actually the largest predeterminant of aging versus the other two, right? And what happens there, you can think of estrogens and plastics, right? Microplastics that are in our system, pollution, no matter where it comes from, whatever source, petroleum-based products that we eat, the American diet, the American food chain, agriculture, and how that's taken, fishing, and how that's taken in the US and delivered to humans. All of those things, including every car accident you were ever in, every stressful situation you've been in, anytime you're taking a pill, anytime you're taking a drink, if you're standing with someone that's getting secondhand smoke, all of that is in those stem cells. So why use 60-year-old stem cells? Why use 50-year-old stem cells? That's not what we're doing. So when these exosomes come into the body in, say, somebody with long COVID, what they do is they hold really they're really the powerhouse of the regenerative process for the mesenchymal cells. And what that how they do that is that they have the cytokines and the proteins. They have all the growth factors, and most importantly, they have the anti-inflammatory effects. So they actually work with the paracrine system, so cell-to-cell delivery and communication. And what draws them? So we already know that stem cells are immune privileged. Well, they're also inflammation mediated. So in a body that's diseased, there is inflammation. Now, whether the client feels like they're chronically inflamed, they are. And so with COVID affecting any system, every system, some systems, that is inflammation. So it's a autobody, a response to the virus and its longevity in the system, and then the inflammation caused by those symptoms that are actually present at the time. So exosomes, again, being nanoparticles, are small enough to cross the blood-brain barrier. So we know that they get into every cell. They can help with neuropathy. They can help with retinopathy because they're able to get into the central nervous system. So really, that is the powerhouse of the cell, and that is really what's driving the progress and the progression in regenerative medicine as we speak today. And we're not just talking about stem cells for long COVID. There's a whole list, and I'm going to go over many of them today. And so did that answer your question regarding how they affect post-COVID syndrome and post-vax syndrome?
Yes, I think that was a good answer. And I'll ask anyone from the panel if they have follow-up questions on long COVID in particular and use of exosomes. Zach, if you'd like to.
Yes. Yeah, I do. Forgive me if it's a bit noisy. I don't know where you are, William. Where in South Florida are you?
Oh, I'm in Fort Pierce on the East Coast.
Fort where?
Fort Pierce on the East Coast.
Okay. Right now I'm in Fort Lauderdale.
Oh, yeah.
So,
I was in Fort Lauderdale yesterday.
Yeah, I'm flying outside so I'm having lunch. But anyway, so when you apply them, it sounds great. When you apply these stem cells or the MSCs or the BMATs with your exosomes, how do you apply them? Is it IV or is it by injectables? How do you do it?
So for what I just discussed with long COVID, it's via IV. When you're talking about autoimmune issues, so there's systemic. So systemic inflammation, they're delivered IV. You can also take, let's say you're doing aesthetics, right? So you can do topical. You can use them for hair regrowth. You can use them for aesthetics, for facial skin rejuvenation. So that would be applied topically or via spray topically. Once the skin was microneedled, there are patches that are available now that are actually FDA approved and Medicare approved for wound care, because that's a huge industry as well. It's a huge expense to the U.S. Medical system. It also makes a lot of money for big pharma and hospitals. However, that's not what the point is. The point is that you can use those to actually heal wounds much faster than conventionally. Losing limbs when you're a diabetic is not uncommon at all. So those patches, you can inject into bone. You can inject. I'm sorry, not bone. You can inject into a joint space, disc space in the spine. So there's various ways. You can also inject into the buccal membrane in the mouth, and then last but not least, you can go IM, so intramuscular injection, and then nebulizer as well. So there's various, so if depends on the disease, it depends on the symptoms, and it depends on the client's history. And then from there, we're able to choose the appropriate modality and way to facilitate that.
Okay, so I'm not going to try and take control. I just want to ask a few questions to understand this.
Oh, yeah.
I have a bit of understanding. So, okay, that's fantastic. So what size needles do you use when you do the IM? Do you have volumes that you take? That's one question. And then the second point on top of that is, what is the 1 hour amniotic cells you get? Are they treated in any way whatsoever, or do you get them fresh straight away? What's the delivery process of getting them from baby or 1 hour age to the patient? how long are they stored for, etc., that kind of thing.
Yeah, so I'll answer the last question first. So the way the cells are procured, what happens is the lab, meaning the tissue bank, right? Not our supplier, but the tissue bank. They are the experts that actually procure the samples. They know how to handle it. I will tell you that they cryo freeze. That's part of the sterilization process. That's first in the system. Then once they're cryo frozen, they're brought back to the lab. At that point, again, the sterility is guaranteed. They're tested by third-party testing organizations to make sure that both the tissue plant remains in FDA-approved labs and techniques. Once they're frozen, they'll be able to be shipped, to an end user. So let's say Odin Stem Cells as an end user, and then we can use those on a client. Now, when you ask for the size of the needle for IM injections, intramuscular, typically you're using a 1-inch, 25, maybe even 27 gauge needle, and the amount that goes in is typically 50 billion exosomes in a 2 to 3 cc reconstitution with normal saline.
Right. Okay, so and then one other question on that again is, if you don't mind me, if you don't have to, who supplies you? You said that someone supplies you with your stem cells. Who is that? Which company?
Yeah, so they're actually both in Florida. So we get our mesenchymal cells from Platinum Biologics in Orlando, and we get our exosomes from Chimera Labs in Hialeah, Florida.
Right. Okay. Not Xeoscientific or Neobiosis.
Now, at Odin, I should say we're not married to any one or two labs, but I will tell you, in the last 5 years, both of these labs have served myself in private practice and with Odin, and Dr. Gant, one of our founders as well. So we stand behind these because of the clinical experience and the outcomes that we've had with our clients personally.
Yes.
Anybody else on the panel before I move forward?
Yes. Anyone else on the panel with questions about long COVID or stem cell treatments? Art Ramon?
I'll go. So let me try to understand. I suffer from long COVID. Brain fog, fatigue, extreme post-exercise fatigue. My muscles quickly fatigue. This has been going on since 2020, and I haven't found a cure either during this time. But I've been thinking of taking maybe TRT to see if maybe increased testosterone might help my body heal. I've had a difficult time doing the graduated exercise. I just can't seem to do that right for it to be effective. And so these stem cells, you said you cryo freeze them. So there is no living cell. Basically, you just need the compounds from the stem cells. The cells are already dead by the time you inject them?
No, the cells aren't dead at all. So they're cryo frozen, and when biological tissue, specifically cells, is biofrozen, they're put on hold, so to speak, right? So they're on scientific hold. They're alive, but they are frozen, cryo-frozen. When they thaw, so for instance, when I get a shipment from, let's say, Chimera or from Platinum Biologics, they'll come in various size vials. Could be a 3 ml, a 5 ml, a 1 ml. They come cryo-frozen. They're shipped in dry ice. Once I've prepared the client, started the IV, if it's going to be an IV, or undressed the wound and cleaned the area, or if it's a spine or cervical neck injections, the same thing, mark via the anatomy and clean the area. Then and only then do I start to thaw the cells. Now, once the cells are thawed, the way I was trained, so it's now my style. I don't let, once from thawing to injection or thawing to infusion, I don't let any more than 7 to 10 minutes at room temperature go by before they're in the client.
Okay, so then you have these.
Just so you know, Art, I have one here I had earlier, dry ice, a couple of mils of some. There you go, it's right sitting there. I can't open it too long, so this is what's in here. This is something dry
ice. That's exactly how they come. Yes.
Yeah. So I just happen to have one lying around. So
My question is more is, you have this foreign DNA. Does this foreign DNA start replicating within your DNA? I mean, what prevents it from becoming a tumor?
Yeah, so it's actually messenger RNA that gets transferred. So when that comes into the host body, right, via the allogenic tissue transplant, right? So allographic, one human to a different human. Yes, they incorporate into your cells. They become your cells. They take on your characters. Now, when you think of autoimmune disease, because as I was saying that, I'm anticipating questions as well. When you think of autoimmune disease, one of the major questions is, well, once you do an allogenic tissue transplant, do you need anti-rejection drugs? And the answer is no. The reason it's no is because, one, it's not an organ transplant. Two, it's a transplant of tissue that's already immune privileged. So your body does not spark any reaction whatsoever as being foreign. So yes, they slip into your own blood, right? Where these mesenchymal cells, they actually are they're located on the outside of your blood vessels. All of your blood vessels, that's where these are sitting. So think of like little octopus, right? And that's where they're all at. And then they're also obviously in the smallest blood vessels, which are capillaries. So that's where they reside. And they know inertly where to go, because of their predetermined intelligence from Mother Nature, I say. So when there's inflammation or when there's damage to cells, if there's damage along those walls of the vessel, they know where to go, and they will congregate there. Now, if we put, say, 2 trillion exosomes into a client via IV for autoimmune or various other diagnoses, are all 2,000 going to stay in one area? No, we know that stem cells travel. That's what they are. They're living cells. And again, once they're already located on the vessels, there's another type of cell called an EPC, so an endothelial progenitor cell. What this does is it resides inside, so it doesn't sit on the vessels, it resides inside. And the sole purpose of these, once they're released from the bone marrow, is to replenish the red blood cells that are dead and dying every single hour of the day. So their only job is to come in, they tore through the vessels. If there's any damage into the endothelium, think atherosclerosis, right, plaque in our arteries, they take care of that. Now, some people, right, like I said, if they're older, their need is going up, but their supply of stem cells or EPCs is going down. One of the largest, so there was probably the largest cardiac study, the Framingham risk score, or the Framingham study. You probably have heard of it. Nearly everybody has, right? So on their risk score, the highest risk of cardiovascular disease is by the lowest number of EPCs in your body. So take diabetes, for instance, right? So we know that the microvasculature is most affected with the diabetes. So that means these capillaries, which are so important to health, are damaged first. So that's where you get diabetic neuropathy, diabetic retinopathy, kidney disease, right? The other thing that actually is actually the worst thing for your EPCs is smoking. So let's say, for instance, that a smoker, let's say that you are a smoker, and you're comparing that to either yourself who does not smoke or another non-smoker. You can see that non-smoker has aged way more than the smoker has aged much, further than the non-smoker. That's because of the loss of EPCs. So there are habits that we all know of here that, our mother told us not to do, our teachers told us not to do, our providers told us not to do. Well, you shouldn't have done them, right? And this is the reason. This is where disease comes from. That, again, sends up the highest risk of cardiovascular events just by the loss of those EPCs.
Okay, so let me get back to the part where they get incorporated into the body. So are you chimeric in essence? You've got this foreign DNA that is just going into and being part of your tissue, but it has a different DNA. Are you chimeric at that point?
No, it's not different DNA. It's your DNA. So it takes on the properties of your body, which is how it's able to regenerate you. If you remember, there are two reasons, right, for a stem cell to exist. One is at birth to make a human, and the other is after birth to actually sustain and repair that same human.
So the stem cells themselves have no DNA in them? They're just completely blank on the inside?
No, well, they have messenger RNA, and then once they're in your body, they take on the properties of your DNA. So your DNA is what these stem cells become.
Okay, so they don't have their own DNA. They only have the messenger RNA.
Correct.
That's what you're saying.
Yep.
Okay. So they don't have the ability to divide on their own like a regular cell.
No, they do. They do divide on their own. Roughly every 28 hours, these cells will replicate.
But how does that happen if it doesn't have a complete DNA to split?
Because once it's in, all right. So when it's inert post birth in the umbilical cord, it's not doing anything. There is no job. That's called medical waste previously, right? But now that we're able to use that in other humans, it's not replicating in an umbilical cord because it's not making another human. The only time it's reactivated is when you put it into a new host, where at that point the host is then absorbing that, and then it actually differentiates into your own cells.
Okay. All right. Thank you.
I would say there is some conceptual similarity there to eating food. So when you take in the tissues of another living organism like an animal or a plant, you're taking in cells from a foreign organism. Those cells do have their own DNA, but you don't start to have their DNA just because you're consuming them. So I assume the body is responding to the stem cells in a way that might promote healing of your cells and replication of your cells that have your DNA, rather than your cells taking on the DNA of the externally introduced cells.
That's correct.
Yeah, I've got
Alan, go ahead.
Moving a little bit different direction. I was really disappointed to learn that Zach's company, which has Austin right in the name of it, is not located in Texas. But thanks for doing great things, Zach. Appreciate that. And I would like to ask you.
I can explain why. Afterwards again.
That's okay. That's okay. But I'm curious. It looks like your Florida company does have some offices in Texas, and could you tell me which one's closest to Dallas?
So we have. So we're a national stem cell company. So we partner with local clinics. We partner with those physicians and that clinic staff. And so, for instance, Miami, North Miami is our base. It's our main office. We have facilities in New York City. We just acquired a facility in Las Vegas. We have a facility in Murray, Utah, so just south, like within an hour or so of Salt Lake City. LA is on board. That's actually one of our clinic partners, Dr. Joy Kong. She's world-renowned educator and an expert in stem cell therapy. So she's with our team. Platinum Biologics medical director and chief consultant expert, Dr. Scott Martin. He's also on our team as well, and his clinic is the one that we just got for Las Vegas. Now, Dallas is still in negotiations. So you would, if you're in Dallas and you don't want to come to Miami, you could choose to go to LA, or you could choose to go to Vegas if you choose. Okay,
I'd like to recommend just not exactly. I'm not in Dallas. I'm in Fort Worth, which is adjacent to it. It's a continuous urbanization sprawl. And in the adjacent county, Tarrant County, we have the Health Science Center which is very big on doing research and commercializing that research, and would probably be a welcoming environment if you were to go present to them. So
now, do they? You mean from a presentation and education standpoint, or do you mean to be a community partner and help and treat our clients?
both.
Okay.
So
That's
I
wonderful.
think that would be good. Yeah. And lastly, it looked like stem cells are based on your website. Looks like stem cells are great for everything that ails me, I'll say. And it's also comes with about an 8K price tag. And is that going to be a separate 8K for my eyes, and then a separate one for my brain, and another one for my spine? Or not that I pay it, but I'm just saying, what am I looking at there?
Yeah, so the $8,303 entry point, so to speak, is our option one. So we offer 3 options, actually 4. So option one is a 1-day treatment with a certain number of cells. Option 2 is more than 5 times that number of cells, and it's a 2-day option. And then option 3 is more than double the option 2 mesenchymal cells and more than 20 times the exosomes as option 2. And again, that's actually two treatments broken up by 90 days. So it's a 4-day treatment. Option 4 would be something that we would use for, let's say, stroke, Alzheimer's, conditions that we know even one option 3 are, would not be sufficient, right? So option 3, for instance, diabetes. Option 3, autoimmune issues. But if someone has chronic, let's say, chronic Lyme's and chronic fatigue syndrome, and they also have diabetes, right? It may be necessary, which is why we have option 4, to add an option 4, which which are additional treatments after you finished option 3. So we do have several price points, but yeah, you're right. The entry point is $8,303.
Okay, super. And that might be a separate treatment for eyes, brain, and spine. So.
Yes, I would like an option 1 to say strictly orthopedic injections, right? If you have two joints, 3 joints, that's really the realm of option 1.
Okay.
Now, many clients quite frankly, can't afford option 4, 3, or 2. So starting them and offering them some stem cells versus no stem cells is another option, is another reason why we still have an option 1. It's a great treatment, but not for multiple, not for comorbidities.
Gotcha.
Yeah.
Yes.
I will say the number of cells, the outcomes are directly related to the number of cells.
Okay. So it sounds like I need to take the survey and follow up phone call.
That's right. You'll probably be talking to me. So talk to you soon.
All right. Thank you for this very informative exchange. And we have a related question from Mike Lazine. He wonders how many healthcare facilities use stem cell treatments in the USA and what states have stem cell treatments available, since you said they are available in the United States. One does not have to go abroad to get them. So what do you know about the prevalence in various states, either from Odin Stem Cells or if you just know which states have them altogether?
Yeah, so all 50 states. So it's legal. As I mentioned earlier, it's legal in all 50 states. I would assume, but I do not know for a fact, that all 50 states have practitioners that will do stem cell. I will tell you, so I'm licensed in 14 states to practice medicine. One of my clinics in Long Island, New York, it's very touchy in New York. Everything is states' rights. So, what is doable in Florida or Indiana, may not fly in Vegas or New York. So it depends on the local statute or the statutes of that state, but there is no state where stem cells are outlawed or illegal.
Yes, thank you. And that's very useful for our viewers to know, and promising as well from the standpoint of patient choice, because they might not even have to cross state lines necessarily to find a provider of stem cell services. Now, we also have a question that was touched upon in earlier discussion. Jessie Martinez writes she had heard that only targeted stem cell therapy is effective, and she wonders, can you tell her why and how intravenous stem cell treatment is effective when perhaps it might not have been in the past, according to what she has heard, and how has the technology changed to make intravenous stem cell therapy work?
Well, intravenous has always been used for and nebulizer as well have always been used for systemic issues. I also recommend systemic IV treatment when someone comes in, let's say somebody with rheumatoid arthritis, right? So we already know it's autoimmune, but we already know there's possibly 20 joints here. There's possibly hip joints and spine involvement. The actual act of injecting someone that many times, quite frankly, is harmful. I think it's mean as well. So the best way to introduce that is not by targeted therapy of those joints. It's by targeted therapy within the entire body because it's autoimmune. When I think of targeted therapy, I think strictly orthopedic, applications. We do the targeted therapy. So actually option 2 and option 3, based on the number of cells and the way we separate it with exosomes first, followed by mesenchymal cells, they specifically will target where the most inflammation is, right? So every disease is different. The one common denominator is the autoimmune response is an inflammatory disease. Does that answer your question?
Yes, thank you for that answer. Now, I heard... Yes, go ahead, Zach.
Can I just add to that, William? I know you don't know much about me, but we work with targeted therapies, but we only use it in follicular organs. So ovaries, epidermis, the dermis, etc., which has a lot of variability, whereby because of its flexibility, you can use targeted. But I agree with you with orthopedics. It's because it's such a dendritic area that you can't do it. It can be damaging if done. We don't do orthopedics. We just work in facilities. But yeah.
So Zach, are you a provider or a supplier or just a true believer?
We've created a combination of autologous VMAX with PDP exosomes to reverse or delay menopause in women. We have about an 85% success rate. But I'm not about me now. We're creative. We're a bunch of scientists. I work with some of the people you mentioned. I know them quite well. So yeah.
Good.
Yes, thank you. And I had heard from another individual who happens to be a type 1 diabetic that she was told that people who get stem cell treatments for type 1 diabetes need to take immunosuppressant drugs, and she has been reluctant to do that for obvious reasons. People usually don't want their immune systems to be compromised, but your earlier comments indicated that that is not necessary, that the immune system does not act to reject the stem cells. So could you tell us more about that? And if it's a myth that immune suppressant drugs need to be taken, how did that myth originate?
Well, I think the myth originated because I mentioned earlier a allogenic tissue transplant. So when we hear the word transplant, I think the general population and many of us in medicine think, okay, you're taking this out and you're putting this in. Well, while it's at the cellular level. So it's not a pancreatic or liver or a kidney transplant. So when you're bringing in somebody else's, so obviously these are living people, right, that donate their organs. They're adults. They're not that newborn baby, right? So everything that they had comes with their organ. Now they're life-saving, right? So they're when they're necessary, they're very necessary. So that's when you would need the anti-rejection drugs. But with mesenchymal stem cells from the post-birth umbilical cord and the exosomes from the post-birth placenta have no reason whatsoever, and there's no research that you have had to do that. Now, when you're even when you're doing say a transplant. So there was a recent study in China, right, where a woman over a year ago, she was a type 1 diabetic. They did not do a liver transplant, but they did a transplant of her islet cells, her insulin producing cells. And so they took those cells from someone and they put them into her, right? They weren't lab raised. So therefore, while she's still off insulin, over a year later, she is destined to a life of anti-rejection drugs. So there is no need when you're doing IV mesenchymal cells to ever need anti-rejection drugs.
Yes, thank you for that answer. And I would be curious to hear more about how the stem cells are used in treating type 1 diabetes and what kinds of outcomes are possible. You stated that patients who had previously been on insulin might be able to get off of insulin. How common would be that kind of outcome? And to what extent would the body's own internal ability to produce insulin be restored? Because that is essentially the ideal situation for someone who is diabetic, to be able to produce insulin on their own again without having to either take in external insulin or severely restrict their lifestyle choices. To what extent is that an attainable outcome today, and to what extent do you think it might be in the future?
So in the future, I think it's very attainable. I use the Chinese study as an example of other technologies that are not stem cell related that there are clinical trials for. There's obviously this one woman, once there's a surgery similar to that with success, others in the scientific community will continue to do their due diligence to make it even better. So science itself, in my opinion, typically gets better. It may take a while, like it has in type 1 diabetes, but none of those future treatments that we know of are using mesenchymal stem cells from an umbilical cord. Now, we do know that there are things called organoids, right? So an organoid is a lab-grown functioning organ. So kidneys, liver, pancreas, fully functioning in a lab made by mesenchymal stem cells. So we know that those mesenchymal cells are able to actually make organs. So when we go down to the cellular level, it's not the entire pancreas that needs regeneration, although what it needs is going to be addressed by the inflammation-mediated nature of the cells. So what does get affected is the worst thing in a human, right? So if you're talking about a type 1 diabetic and even a type 2, you're talking about the insulin producing cells and the pancreas. And since there's that intelligence already built into the cells, I don't program at all. I think one of the panelists asked me if we program cells. They don't need to be programmed. Stem cells in the United States, because of the FDA restrictions, are not allowed to be programmed or reprogrammed in any way. So it's the purest form of cell. It infiltrates your cells. It goes to the area that's most in need via inflammation by cell-to-cell signaling. So it targets those cells. Recently, let's say in the last 2 years, we've had increasing successes with type 1 and type 2 diabetics, with clients being able to either greatly reduce and several clients that were actually able to come off their oral medication. So now that isn't just do option number 3, go home and get all these bad habits, not exercising, take up smoking. It takes some work, right? So it's a combination of healthy living. It's a combination of diet and exercise, and proper diet and proper exercise. Activity, it just is so important to us that our bodies really need it, especially as we grow. One of the studies that I talked to clients about, it was a study in 2023, so that's a recent study over in Iran. They were doing the study was on newly diagnosed type 1 diabetic children. And they found out that one of the largest predictors of outcomes was, depending on the age, was that child active? Was that child able to exercise? And of course, as a child, a minor, do the parents recognize that? So there's a bit of education that goes into it, because the client and or the client's parents, right? They have to see the big picture, and the big picture isn't come down to Miami and get an infusion and we'll never see you again. There may be a need with autoimmune, with any autoimmune disease, that you may need a booster. Your issue may come back in 2 years. Your issue may come back in 12 years. I have a client, actually a potential client. He had a pancreatic transplant 21 years ago. They typically don't last that long. So kudos to him and his team. But it did fail. He had to go back on the list, and he reached out to us for a consultation for stem cells. The amazing thing with him is, one, it lasted that long, but two, his autoimmune system finally kicked back in and even got this second pancreas. The replacement pancreas. So we know it happens. That's the basis of autoimmune diseases, right? That's why they're so devastating to not just the public health system, but to, more importantly, the client themselves. So I believe it's possible. We're starting to see it now with stem cells, because the ability for them to differentiate into other cells within your body and repair is their number one job after making that human at birth.
Yes. Thank you for that answer. And it does seem like, as with any sort of disease treatment, the treatment itself is not the only thing that needs to happen to help the patient. Lifestyle choices matter a lot, and healthy living practices should be adopted by everyone. Now, you were going to provide a bit more of an overview into the kinds of disease conditions that are able to be treated today. So please feel free to proceed with that. I'm sure it'll be fascinating and lead to some additional questions as well.
Absolutely. So it's a very long list and growing. I will start with where I started first, and then as my expertise and experience, gained throughout the years, the other treatments that I found out, also were accepting of stem cell regeneration. So you can think of any musculoskeletal issues. So again, sports injuries, meniscal tears, ligaments, tendons, osteoarthritis. You can think of degenerative disc disease for spinal cords, injuries such as derangement with meniscus or labrums being torn, soft tissue neuropathy, and sports injury, including chronic pain. And then we have autoimmune. I've mentioned that several times. Besides musculoskeletal, autoimmune is probably the biggest thing that we treat. So with type 1 and type 2 diabetes, we know that A1C has gone down, and C-peptide, which is the marker that shows us the health and the ability to generate insulin in the pancreas. And again, type 1 and type 2 that works on. Lupus, rheumatoid arthritis, chronic Lyme's I've mentioned before, chronic fatigue syndrome, scleroderma, right? And scleroderma is a disease that could affect everything and anything in the body. It could be lungs, it could be brain, it could be musculoskeletal, or it could just be dermatologic. Your GI system, right? Your gastrointestinal, Crohn's disease, ulcerative colitis, inflammatory bowel syndrome, an irritable bowel syndrome. When you look, you remember I mentioned the Framingham risk score before as one of the largest studies, for cardiovascular in the last 3 decades. From a cardiac standpoint, it's now being used specifically for the anti-inflammatory effects of the exosomes. You can treat congestive heart failure, or you can apply, not treat, you can apply it with a congestive heart failure after heart attack, and then atherosclerosis to break down plaque. Neurologically, you're looking at it's being used as well as an application for ischemic stroke, hemorrhagic stroke, TBI, so traumatic brain injury. Incidentally, one of our founders is a 12-year combat veteran. And when he, like many of our veterans, come back home, what they endured and what their body and mental health was through is not anything that a non-veteran, specifically a non-combat veteran, can even understand. So when they come back, they're typically in need of help. Many of them, from a mental health standpoint, with PTSD, they're suicidal, they're full of anxiety, because of everything that happened in that war theater. So he founded, along with his two partners, Odin, and specifically to target veterans. Now, once we started doing that, we realized of all the other people and all the other diseases that I'm in the process of listing. So while we have an affinity toward our vets, we treat everyone, whether they're veterans or not. But speaking of that, when you think of spinal cord injuries, traumatic brain injury, all of those are amenable to exosomes and mesenchymal stem cells. Alzheimer's, migraines, including chronic migraines, there's an application there. Then we think of reproductive and sexual wellness, right? So you're looking at there's studies out there for premature ovarian failure, of course, erectile dysfunction, premenopausal ovarian syndrome, and there are two trademarked sexual wellness techniques by Dr. Runnels. One is the P shot for men, and the other is the O shot. And again, I'm certified in the O shot, but that's the use of PRP, platelet-rich plasma, and umbilical Wharton's jelly, which carries those mesenchymal cells, for improved sexual, not just performance, but sensitivity. It also helps with women for the O shot with urinary incontinence. So it's a fantastic application. When you're thinking the respiratory system, lung injury, asthma, it's reactive airway disease, COPD. With eyes, we're applying it to glaucoma, diabetic macular degeneration, something from the behavioral realm. It's now being used as well to improve behavior in autism. So children with autism, regardless of the spectrum, are showing improvements both in language and in behavior. Sports, right? So with me personally and through Odin, I've treated UFC, MMA, arm wrestling champions. So arm wrestling champion Devitt Larratt and Sarah Bachman, both of those are clients of ours because of their sustained and repeated, soft tissue and musculoskeletal issues. So of course, where I started off originally, I'm still using it today in those types of, athletes. Now, Dr. Joy Kong, I mentioned before, she's the founder and president of the American Academy of Integrative Cell Therapy. In 2022, she presented at the International Cell Surgical Conference, where she presented a great deal of clinical evidence via studies for many of the diseases and conditions that I just went over. I'm just going to go over a few because we've kind of already touched on those. So a 2010 study using umbilical cord derived mesenchymal cells via transplantation, lupus. There were 16 patients. Within 1 month, the disease severity decreased. In addition to that, the markers, anti-dsDNA and ANA, both improved into clinical remission, and the decreased disease activity was achieved in all patients with no reoccurrences for 3 years from the published date. That was 2022. There was another study, 40 patients, again for lupus, using IV umbilical cord mesenchymal cells, were infused day 1, and day 7. They've had no adverse effects, and the major clinical response was achieved in 32.5 of those. When you're talking about rheumatoid arthritis, right, another autoimmune disease, there was a 2013 study that had 172 patients and with active RA, so rheumatoid arthritis, who were non-responsive or poorly responsive to disease-modifying prescriptions. So they divided it into 2 groups. And again, it was 172 sample size. The disease-modifying drugs and placebo was group 1, and then disease-modifying drugs and umbilical cord stem cells. Group 1 showed 0 improvement at all. Group 2 showed significant improvement in 2 weeks. And then joint pain and swelling with rheumatoid arthritis was alleviated in 12 hours. So this is pretty powerful stuff backed by scientific studies. When you look at irritable bowel syndrome, there was a study in 2016 using hematopoietic stem cells, which are the stem cells that make blood vessels and red blood cells. We don't use those. They're mainly in cord blood, and there are some gray areas, whether they are truly safe or not, or do they truly cause cancer. So right now, they're not even allowed by the FDA. However, back when this study was done in 2016, they found out that of those 900 patients between 1996 and 27, so for 11 years, the allogenic, right, one human to another human, results were that genetically corrected the underlying disease. And then from the gut as well, Crohn's disease, IV treatment for moderate to severe Crohn's, 148 of 207 patients saw remission, and the mucosal layer was fixed and repaired within a 12-month period. People worry as well. I mentioned hematopoietic stem cells as another source. They worry, or they heard, or they've read about graft versus host disease, which can be deadly. That is only seen that's only been seen with the use of hematopoietic stem cells, which I just told you there are some real issues. So the FDA stopped that about two years ago. And then, of course, the Transhumanist Party is a friend of anti-aging. So many clients will use mesenchymal stem cells with their exosomes for IV. They'll come in quarterly. They'll come in monthly if they choose, because it's an elective procedure, and there are no contraindications other than being on chemotherapy or radiation, which of course would kill the cells. And those clients are seeing better longevity, right? So fatigue is greatly lessened or gone. Their thinking, their brain fog is much sharper, the brain fog is gone. Their thinking and decision making is much more sharp, and they're able to do more because they feel better. So again, anti-aging, and then you think of aesthetics, right? We all want to look good because we want to feel good. So aesthetic medicine using stem cells and exosomes, I've been doing that for 8 years now. So really, really, really impressive studies that are out there.
Yes, that is an exceptionally wide array of conditions that you mentioned. Now, I'm curious because I have heard accounts from people using stem cells to treat various conditions, particularly various injuries. You mentioned orthopedic applications, and those have been around for some time. Mm-hmm. People have mentioned that when they initially got the stem cell treatments, they worked very well and they alleviated essentially all of the problems associated with those injuries. But over time, the effect wore off and they had to go back for another administration of the treatment. And so I'm curious, first of all, why does that happen? Why does the treatment wear off over time? And second, how often must one go back for particular conditions? Does it vary based on the condition? You mentioned people who pursue the anti-aging applications might go back fairly frequently, monthly or quarterly. Yeah. Now, if one were to use the stem cell treatments to treat some sort of, let's say, more acute condition like an injury, is it possible that they might only need one administration, or would they have to come back? Would the damage come back if they just got one treatment and let it take its course, so to speak?
Yeah, so that is what you said is mostly true, right? And by that, I mean, do clients with musculoskeletal injuries, some clients, I should say, have to get boosters or retreated? Yes. So what I do and Odin does is that when we're doing strictly joint injections, we would be using, one of the three options I mentioned earlier. And then typically what I do is I add about 1 to 2 months later, an additional treatment of the Wharton's jelly of the umbilical cord, just as a booster to alleviate the need for that second or third treatment. Now, I will tell you, in 8 years of doing joint injections, I've had clients, let's say 37 years old. I had a tattoo artist, 37 years old. He obviously, if you think of the posture, what it takes to work to, long hours in odd positions. This gentleman, his cervical spine, his neck was shot. He was literally going to work. So an 11-hour session turned into an hour and a half. He was crying. He was ready to retire. He was ready to quit. And as with many people, when you lose your livelihood, what you identify with the most, you talk about anxiety, you talk about suicidal tendencies with depression. So we treated him with joint injections. So he had 8 joint injections in his cervical spine to the parafacet areas, and he has not stopped singing our praises since that time. I never retreated him. He doesn't need retreatment at this time. I've had clients that they have degenerative disc disease, degenerative joint disease in their spine. I do the injections there, and 6, 8, 10 months, they come back and they request a follow-up MRI. So oddly enough, 2 or 3 of those, the MRI is actually worse than it was prior to treatment, which tells you that the degenerative process does and may continue depending on, did you put on weight? Are you exercising? Are you eating right? And all of us are it's very subjective. So one person may not get anything out of stem cells, and another person, like the tattoo artist I said, may get miles and miles above what others can expect. But with musculoskeletal, the reason that happens is because the exosomes that handle the lion's share of the inflammation, they're only going to last in a body, and it's unknown, right? They're only going to last for a certain amount of time. So you may need retreatment. So I've had clients that didn't need a retreatment for 3 or 4 years. And really at that point, it's not a booster, it's not maintenance. It's a need for retreatment because their symptoms have come back. Or let's say it's the same joint, could be a knee, could be a shoulder. We have a lot of pickleball players down here in South Florida, a lot of tennis and golfers, many retirees. So it may be the same shoulder 3 times for treatment, but all different injuries just because they're doing that repetitive motion. So it could be anything and it could be everything. And that's really what stem cells do. Sometimes 0, so 2 to 3% of the population. Unfortunately, there's no test to say, oh yeah, that's one of those people. Keep your credit card in your wallet. You just find that out over time.
Yes, thank you. And with regard to stem cell treatments for type 1 diabetes, do you also observe the efficacy waning over time? Do people need to come back for repeat administrations of the treatments?
So I've only had one client after 18 months that needed to come back because her A1C was going up again, her fasting glucose was going up again. And we also follow lipid panel or cholesterol because that's an independent risk factor for heart attack and stroke with diabetes, type 1 or type 2. So she needed to come back. I did, let's say I did an option 3 the first time. And then when she came back 18 months later, what I did is I called it a booster. I gave her option 1 as that booster, and she hasn't been back since. So that's in the last 2 years. But any autoimmune disease, I think it's fair that one should, first off, the clinician should be educating the client of possible expectations, right? Both pre and post treatment. But it should be relayed at that time between provider and client that they may need a booster in the future. How long do anti-rejection drugs last? I mean, even those aren't permanent without some damage going on or some rejection coming on. So the body wants to return to homeostasis. It likes what it is, even when it's damaged. So when you use something biological like stem cells and exosomes, there may be a need for it to be redone.
Yes, thank you for that answer. And now we have a question from Zach Varkaris.
Yes.
Let's see, Zach, you need to
Yeah,
unmute.
I'm off mute. Yeah, I'm off mute. So the question, William, you're talking about, well, I have two questions. The first one is that in the beginning you said you had 100% success rate, and now you sort of say, well, it doesn't work for everyone. There's a few people that haven't worked. So I understand that, numbers are numbers, but what do you define as success? And what you define as, how do you grade that success?
Yeah.
So
success is, there couldn't be anything more subjective than success, right? So when you, and I talk to the clients about this in consultations, when you had a disease or a diagnosis and you needed these 3 medicines or this one medicine, and you needed it every day because your providers put you on it and you meet all the criteria for that disease. And then over time, post-treatment, and I'm talking 9-12 months down the road because of the recuperative powers of regeneration. When you get to that point, success is described by the patient as, well, I'm 20% better. I mean, my insulin load went down, from 90 to 30. I feel great. I don't have to worry as much, when I'm traveling to bring things. When you mentioned 100%, what I follow. So I mentioned before C-peptide, the lipid panel, A1C, and fasting glucose. Now, in 100% of those 125 diabetics, both type 1 and type 2, in 100% of them, all of those metrics improved after treatment with IV mesenchymal cells and exosomes.
Okay. So, I get it now. Okay, I understand. And so just out of curiosity on that type 1, type 2, how do you find the differentials between one being an autoimmune issue and one being an inflammation issue derived from like glucose and that kind of issue? How do you differentiate between that?
Are you talking about diabetes or disease in general?
Diabetes, sorry, the type 1 and type 2. Because one obviously comes from an autoimmune issue and the other one comes from a lifestyle issue, which then develops into, sort of inflammation and therefore sugar and yada yada. So
yeah. So for type 2 diabetes, you're correct. It's a disease of obesity, right? It could be obesity. It could be obviously
a disease of riches. A disease of riches.
Yeah, right. Exactly. So that's pretty much the catalyst, but also it has a strong genetic component. Now, it may never materialize, right? You could be predisposed because of one parent, 2 parents, several siblings, and yet you don't ever get diabetes. So yes, while it can be lifestyle related, and often is, right? It's just like hypertension. The lifestyle changes that one can make can literally get them off medication for both type 2 diabetes and hypertension. So we know that, right? That's where you eat correctly, get enough sleep, exercise, 4 or 5 days a week. So all of those things work. Number one is lose weight for both, right? So even a 10-pound weight loss for both type 2 diabetes and hypertension can improve or even remove the need for oral medication in both those diseases. Now, autoimmune, we've discussed throughout our session today. Autoimmune is the stem cells know where to go because they're immune privileged. and because they're inflammation mediated. So while they may while they may adhere themselves to one organ or one structure in this disease, the common denominator for autoimmune diseases is chronic inflammation. So that is what they're addressing.
And also, not to argue, but just because it's an interest, I understand what you're talking about. When you have that situation, do you find that when you're having, say, a type 1, if there's, say the patient has had an injury to their leg, say they've I don't know, there's a really big gash in their leg.
Yeah.
Would that affect where the stem cells, or the exosomes rather, more importantly, I suppose, where the exosomes would go in the body because you're doing IV and systemically, or do you find it makes no difference, or do you have no data on that? It's a personal thing, really.
Oh, it definitely makes a difference. So, for instance, the scenario that you just said, and I mentioned patches before that are approved for diabetic wounds. So we already know that they work, and we already know just the contact at the skin level, transdermal works. But specifically, when you're doing IV systemic treatment, we know by radionucleotide tracing that stem cells travel, right? So even if it's a closed capsule like the knee, right, or any joint, and you're putting the lion's share in that joint because that is what the client is asking you to treat, right, through the history and physical. Well, I have seen, and we know that those cells don't all stay there. What needs to stay there based on inflammation will stay there. The other cells are in the blood system. They are literally hitting every vessel everywhere, and they're ready to do their job. Again, lion's share in a joint, it doesn't mean it's staying there. So I call these, I call them stem cell surprises. It's clearly not a clinical term. In my practice over the last 8 years, I will tell you some of them. So I had a client that I treated IV for post-COVID syndrome. I didn't even know in her history, she didn't reveal that she had a tremor. It wasn't something that I saw in the physical exam. So I treated her for post-COVID. And as I told you earlier, at the beginning of the session, she completely lost all of those symptoms, right? So in a very short period of time. So about 2-3 months later, she calls me to renew her prescription for her tremors. And the first thing I said is, what tremors? And second thing I said is, I'm not your primary or your neurologist, so tell me what's going on here. And she said, well, I've had a tremor since, 6-7 years ago. And I'm like, oh, well, that's news to me. I'm like, well, how's your tremor now? And she goes, to be honest with you, since the COVID treatment, it's kind of gone. I'm like, okay, well, give it 2 more months, give it 3 more months, and then just call me back. I wasn't going to renew her prescription. I wanted to find out what is going on with that tremor. So she did, because she's a very loyal client. I see her all the time. She, to this day, that was 3.5 years ago, her tremor is gone. I had another gentleman, an obese type 1 diabetic, who had degenerative disc disease in his lumbar spine, very, very common. So I did the Parafacet injections for him. I was strictly treating his lumbar spine. Within several weeks to a month, he was feeling much, much better. And again, he remains obese, so he didn't do anything on his end to help the matter, but his lumbar spine greatly improved. About 2 months later, he walked in because he was a frequent client for getting, recreational IVs, let's say. And he's like, hey, doc, and I'm not a doctor, by the way, but he says, hey, doc, I got to hand it to you because I haven't felt my feet in 10 years. I'm like, what are you talking about? We're talking about your back here. He says, no, I've been a diabetic for like 15 years and haven't felt my feet in 10. So he actually had his neuropathy addressed by the stem cells and exosomes. So it happens. It's happened to me clinically, like I just relayed to you. So yes, to answer your question, that wound will probably get addressed. Now, is it enough to cure that wound? I don't know, because what's happening on the outside? Are they dressing it? Is their diet, conducive to wound healing? And we already know if they're type 1 or type 2 diabetics, they're immune compromised, right? So those wounds take much longer.
Right. So what I'm saying is, say you had 2 patients, both type 1 diabetic, both of them 50 pounds overweight, both of them soda kings, blah, 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 right? And then one of them happened to have a bang on his leg, and the other one did not have a bang on his leg. would the stem cells, would the efficacy for curing or mitigating the effects of type 1 diabetes be lessened by the person with a bang on his leg? That's what I meant to say. Yeah.
So I would say possibly, right? So I just
Right.
went over how we know that the stem cells, travel, right? Depending on the size, depending on the health of the client with the wound. But again, they're already immunocompromised. I wouldn't necessarily raise the cell count per se for the diabetes, but what I would recommend, right, is to look into wound care specialists that uses patches that also uses stem cells. So topically, transdermal and IV, and then the diabetic without the wound. That's the reason you're treating diabetes or any autoimmune system, but specifically diabetes while you can now, because we know that it leads to end organ damage, right? Kidney disease, vision issues, retinopathy, neuropathy. If a diabetic is lucky enough and controlled enough for a long period of time, and I talk to them every day, where they have none of those end organ issues, they are going to do much better and their outcome is going to be much quicker. And again, by quicker, 2 months, 3 months. It's not going to be many, many years. Their outcome will apply itself in a much more quick way.
And one last question, and then I'll get off the line. Which is the thing is you say how long it lasts, okay? How long, do you have any idea of how long? So if, for instance, you said about testing whether someone's going to have the effectiveness with a joint, are there any? I can go offline with this, but there are some tests you can do to maybe see if someone's more susceptible to it being efficacious or not efficacious. I mean, do you do any testing at all like that, or do you have any idea from your experience? Because you've got years of experience, which is phenomenal. That's worth years of the lab work. I promise you, it really is. That years of experience.
Are you talking about, say, orthopedic tests that get me closer to the actual diagnoses and MRIs and X-rays? Are you talking about that?
Yes. So yes. So in essence, like, do you do like a DNA test to see whether someone has an issue with, say, CRP reactive protein and so that causes inflammation, instead, an IL-33 or something, whatever it is, whatever the numbers we decide to choose, and that will have, you have a predisposition to have inflammation in a joint, which maybe if you're of a certain type of genetic morphology, that's what you would have, and if you don't have that, so I don't know, say if you're from a certain part of Asia, you might have a tendency towards inflammation. You know what I mean? Yeah,
I understand. So the answer is no. I don't know of, and I have, whether there are or not, I've never used a DNA testing for propensity to have inflammation or to respond to stem cells. Perhaps there's something there. It should be, right, part of the developing
there is.
Science of disease management and hopefully eventually obliteration. But I've used those tests, and typically the reports are, a half a day's work. I mean, they're about 40 pages long, but I've only used them when I was doing mental health, because I was doing mental health and addiction for 12 years prior to doing regenerative medicine. And we used them for recalcitrant traces or cases that weren't responding to even, let's say, their lipid medication, but they weren't responding to antipsychotics. They weren't responding to their SSRIs. So when you do that, and many clinicians in mental health don't even think about it. You might have the client on the wrong medication or multiple wrong medications based on their DNA tracking. That has done them no good for as long as you didn't get a DNA analysis. So they are great tests. I do like them, but I've never used them for predicting inflammation per se.
Yes, thank you. This was a fascinating conversation. And I wanted to address some of the questions from our viewers who are interested in, let's say, the accessibility and affordability of stem cell treatments. Mike Lazine wonders, are your clients paying out of pocket, or is their health insurance helping out in some way? Do you know of health insurance plans that cover stem cell treatments, or is it essentially on just a direct payment basis that these services are provided?
Yeah, unfortunately, Mike, this is out of pocket. No insurance pays for regenerative medicine. The main reason given for that is while stem cells are FDA allowed, i.e., they're legal to use, they are not FDA approved. So there are theories out there of why that's so, but I will just share with you that the largest funder of the FDA is Big Pharma. So there's not a lot to gain when you're using stem cells because you can't patent them. They're not a drug. They're a biologic. So they're in a quandary. And unfortunately, you, Mike, and everybody else suffers for that. So what we're hopeful for is, through forums like this and testimonials from our clients, that we're going to change that front. Again, Odin, right? Wisdom, war, and magic.
Yes, and thank you for that answer. I definitely think patients should have more access to stem cell treatments, and I do also wonder about some of the FDA's approval decisions. We have a few more questions along these lines. Mike wonders, could it be that doctors feel like they don't have the proper clearance to even, let's say, guide patients along the route of pursuing stem cell treatments if they already know in advance that health insurance will not cover them, or they haven't been explicitly FDA approved, just like doctors will often not tell patients, oh, purchase some over-the-counter supplements to help your condition, though some good doctors I know have done that and have recommended inexpensive supplements that could help. Do you think that the way the conventional medical system works in terms of not recommending stem cell treatments is very much constrained by what the FDA has explicitly approved or what health insurance companies will explicitly cover?
So yes, welcome to conventional medicine, right? So unfortunately, Mike, I wouldn't even give conventional medicine practitioners that much credit that they didn't know that it wasn't covered by insurance or they steered you away from it. What I've seen in my career, and personally speaking to many, many clinicians, because we try to collaborate. Again, we're not going to be your primary treatment provider, but we would love to collaborate with that provider. I'm turned down more than I'm encouraged to follow collaboration. So I've been called, and not in a good way, right? I've been called a wizard. I've been called an alchemist. I've been told by specialists, specifically, off the top of my head, neurologists and pulmonologists, again, highly educated people, very, very smart, but trained within what they do, and they don't see outside at all for any alternatives. But they've actually just turned me away. They wouldn't even pick up the phone. And it was the client that made the three-way call. They won't even get on the call with me. So I don't think it has anything to do with clearance. I think it has to do with general apathy for humankind, that you cannot get out of your own way to help your clients heal.
Yes, thank you for that answer. And one other question that Mike has had is in regard to whether there might be some change to how the federal government may be approaching stem cell research with RFK Jr. as the Secretary of Health and Human Services, because he himself has sought out stem cell treatments from what I understand. So Mike wonders, how would he, in your expectation, affect stem cell research on the federal level, or the federal government offering federal grants for private research for stem cell treatments? Do you have any outlook on that?
I do, and we do at Odin. I mean, I hesitate on a call like this to use the word giddy, right? But when RFK was approved and came on board, we were happy, very happy, because any previous administration, that again, that's not the way they were thinking. That's not the way they're going. They were conventional in every way, right? Because with large systems, such as the U.S. bureaucracy, there's an element of safety in not changing, right? Well, this has worked for 200 years, so let's just keep doing this. So yes, I do believe that RFK is going to make drastic changes. I do believe the FDA approval process via RFK is going to be either greatly enhanced or greatly penalized for what they have been doing thus far. Again, the priorities I think RFK has is help people, and the priorities that the FDA has is help big pharma. Now, I am not saying the FDA does not have value. They definitely do, right? Safety is their bottom line, but you don't get safety also by keeping working treatments, novel treatments away from people.
Yes, thank you for that answer. And let's say there is a change in the federal approach towards stem cell research. Let's say it becomes more accepted and demand for it increases. This is a question from Jesse Martinez. If demand does increase for these services, do you think in the future the treatment cost will increase and it might become unaffordable for blue collar people? Or do you think the supply could keep up with demand if there are more patients who are interested? Do you think there will be new clinics forming, or existing businesses like Odin Stem Cells might expand to fill that demand? What can you say about the supply essentially being able to keep up?
Yeah, so I believe that the supply would not be the issue. Again, the donors are volunteers; they're not paid in any way. So as long as there are altruistic people in the world, that should not be a problem, right? It hasn't been a problem thus far, and the way the number of cells that can be produced from certain tissues has been adequate to this day. However, to answer the other part of your question, I don't think as the demand increases that the price is going to go up, right? That's what we would think. It happens in every other industry. But in the 27 years I've been doing medicine, I was around in 1996 and 1998 when U.S. healthcare came in, and Blue Cross Blue Shield, Big Blue. What they did is they were basically buying out practices and moving them into a hospital. So if there were local doctors in the area, primary care, they've been there for 20 years, the neighbors love them, they were getting bought out and moved into a hospital so that they can be better controlled from a billing standpoint. So it's about billing. So even though the demand may go up, if the thought is that once FDA approves it, prices will go down because insurance companies don't pay anything anyway. So you may take a $8,300 and 3 option 1, and once insurance is involved, you might get reimbursed $550. So there's going to be a problem from the supplier side, right? So as a provider and you don't take insurance, well, a lot of your patients just went away for basically what equals a Groupon for stem cell. So the access may improve, but the quality will not. And the number of providers that are willing to take dirt cheap prices for what we know is very intricate medicine is going to affect the public.
Very interesting. So a nuanced answer, and I appreciate that. I think we're going to have to see how the FDA is inclined on the question of stem cell treatments, and also whether more conscientious providers could emerge into that market, the ones who are willing to administer a quality treatment that has efficacy. So thank you for that. Now, Josh Universe wonders, where is Odin Stem Cells physically located in Florida, And do you have a physical office, or do you visit clients in their homes for treatment?
Yeah, great question. So we are in North Miami Beach. That is where our clinic and our main office is, even though we're a virtual nationwide organization. And then the last part was, what was the last part again? Okay, visit. Oh, yes.
Yes.
And we also, so for clients that can't travel, right? So let's say severe autoimmune issues, even related to aging, many clients, or even economics, right? Clients we understand can't treat. So what we're able to do for those clients when it's unrealistic to go to one of our partner clinics is that we will be able to send a concierge IV nurse to your house, because if everything is IV, and the majority of our treatments are, that can be administered in the comfort of your own home.
Yes, thank you. And Josh also wonders, what is the physical address of your office so that people
So,
can contact you?
Great question. I don't work there, and I left the sticky note on my desk at home. That's something I can get the panel
Okay.
for you, Josh, if we're able to reach out to you.
Yes, so you could send it to me and I will post it in the comments within the YouTube chat, or I could even
Perfect.
edit the video description afterward to include it so that that information is available for anyone who is interested.
Thank you.
So, yes, good questions, Josh. And we have about 13 minutes left in our salon. I wanted to hear a bit more discussion from you about where you think the future of the stem cell therapy field is headed within the next 5 years, and then within the next 10 years. What treatments do you think will be available, and what kinds of results will we see in patients? Hopefully, a greater array of cures for diseases, or helping the body cure itself of diseases, but I was curious to hear your anticipations of that.
Yeah, so I think I think it's all positive moving forward. Not governmental bodies intervention withstanding. The science is there, and the more because just like most things in science, you can read any educational paper or white paper, and typically in the conclusion, the last 2 or 3 sentences is, but more studies need to be, completed so that we have more information. Well, that's true. That's true of any disease. It's true of any discipline. So I think that there will be more papers, more clinical trials as outcomes like what we've discussed here today, and the possibility of increasing the accessibility to the public. And one of the questionnaires said, blue collar people, right? Well, blue collar people is, that's the mainstay of America, right? They're working, they're injured. I mean, I'm in that category. I've had both my shoulders treated, most recently for stem cells. I've treated myself for bilateral brachioradialis, which is, epicondylitis. I've used the P shot per se with the Wharton's jelly that we use with our clients. Again, with excellent results. So the results are already there. The results I've seen in the last 8 years speak for themselves for me to continue in this practice. Otherwise, I could go back to mental health if I thought this whole thing was a sham, right? Our medical director, Dr. Gant, has been seeing the same results, all successful, or mostly nearly all successful over the last 5 years of his experience as well. So I think as time goes on, again, not regarding what someone else in a big organization is able to block, the science is there. The access will be improved. I believe the prices will be coming down, which again increases access. And 5 years from now, I think it should be covered by insurance. I think it's an elective procedure for preventative medicine. So when obviously we've been talking for decades about, well, why does your insurance cover a 5-day medical, a hospital stay, but they won't cover a brace or Ozempic to lose weight or whatever the case may be, right? It does not make sense. It's a business of exchange of money. Unfortunately, when those institutions that run those disciplines, and quite frankly, the governmental systems as well, when they're involved, we suffer. So patients suffer, whether it's lack of access, whether it's myths of stem cells being running rampant. So in 5 years, I think that every person should be able to elect IV therapy just as easily as you can go into, let's say, any anti-aging clinic now that does IV therapies. It should be accessible to everyone.
Yes, thank you for your answer. And Josh Universe says you are a very good speaker. He wonders a bit more about your role at Odin Stem Cells. You're described as the clinician there. So do you administer a lot of the treatments yourself? Do you have a team that's helping you? And do you do it at your location, or do you go over to that main office you mentioned in North Miami Beach?
Right. So other than my office in Long Island, in Jericho, Long Island, where I actually do treat our clients, and in my private clinic here in Fort Pierce, where I treat my private clients, I don't treat clients that are Odin clients. So very much like the time we've spent here today, what I do in consultation is I answer the questions of the potential client, and they are numerous. Many times I'm speaking to them and their Facebook group. I'm speaking to them and their significant others and their extended family. And, I'm doing these consultations, 45 minutes, 1 hour, trying to educate clients to make their own educated decision. I'm giving those clients scholar.google links. I'm giving them papers. I'm giving them testimonials to educate them so that they can make their own educated decision. So I'm not treating other than in New York for Odin, so Jericho, Long Island, and then Dr. Gant. So it's him and I he's the medical director and I am on the medical team. We've worked together privately prior to Odin. So we understand the benefits of regenerative medicine, and we've seen the results ourselves. So the two of us are the medical team. Whenever there's a consultation coming from a client, anybody answers a Facebook ad or picks up the phone or receives a text or inquires in any way, you're eventually going to be speaking to me or you're going to be speaking to Dr. Gant. So we keep it very, very personal because every treatment plan is personalized for that individual client. And you don't get that. You don't get that depth unless you're interacting with the client. So I hope that answered your question.
Yes, thank you. And the kind of information that you provide to your clients would seem to be quite in-depth and focused on scholarly research. You've certainly demonstrated that in our session today. And Josh also echoes this. He says, this is such a wonderful talk. Thank you so much for your time. And thank you, Josh, for being engaged in our chat. One of our other loyal viewers, John H., notes, we're so absurdly vulnerable to so many things. This is in response to all of the conditions that you identified. It's borderline miraculous that any of us last a month in this time space. And yet somehow each of us manages to find their way through, let's say, the labyrinth that is life and having to deal with various health issues as they arise. Now, one aspect of this is lifestyle that you mentioned and prevention. So John wonders, is prevention any part of your regimen? And I suppose one could take this question in two ways. One would be with regard to your own regimen, because until you said that you were in your early 60s, that's not something I would have expected looking at you. Many 40-year-olds or 40-somethings look that way. And moreover, is prevention part of the regimen that you counsel your patients in when you have a discussion, especially when they get a particular treatment, but that may not be the entirety of what's needed to address their condition.
Yes, great inquiries there. I'll touch on me last. I'll talk about the first part. So prevention to me is paramount. I will tell you, it started before I even graduated school. So I went to school in the Philadelphia area, Jefferson University, and while we were doing rotations and internships, I did my first internal medicine externship, right? So we're in local hospitals and we're rounding with the hospitalist. And I will tell you, after 3 days of rounding in a hospital where there are amputations going on, where there is, a 31-year-old with end-stage liver cirrhosis from alcoholism, clients getting having to get tubes put in their belly to remove the excess fluid from failing organs. I had a 32-year-old client because of smoking, right? And we always think, well, you're young. What are you going to get at 31? Well, she got cardiovascular disease and had 2 heart attacks within a 6-month period before she was even 32 years old, just from smoking. So when I actually was exposed to that, it hurt. It hurt on the inside. So every client I see, whether it's a joint, whether it was for high blood pressure or diabetes back in the day, and even consultations that I do now, if there's an opportunity to present preventative measures, I am absolutely going to do that. That being said, you probably could guess that I am prevention oriented in my own life. So I exercise, I don't drink to excess, right? Moderate alcohol intake. I don't smoke. In fact, 10, 12 years ago, I smoked cigars and really liked them. And there's no reason to, right? So I can do better things with my time off that are more preventative for me as I age. I do appreciate the comment that, maybe I look more 40-ish than 62. I will be 63 in 3 weeks. And a large part of that is because I live a healthy lifestyle, exercising. While I love, pizza and the occasional buffet, it's usually clean eating or keto. Not only that, I think we all have a personal vanity, right? Or we even should. If people were more concerned with themselves, right? We're brought up, our parents, our significant others. Well, don't be selfish. Help that person out. You don't need that, right? So we tend to sacrifice ourselves for the greater good, per se, not society, but those around us, right? We give. Well, at around 48, I stopped that. So I take first because I can't give anything unless I am as pure as I can be. So I keep my health going so that I can help others and continue to make a difference.
Yes, that's a great answer. Thank you very much, William. And I think there's a lot that people can take away from that with regard to their own personal habits. And what you've articulated is essentially a philosophy of rational self-interest, a kind of long-term oriented rational self-interest where one realizes one has to take care of oneself and attend to one's own well-being in order to be able to do anything else in the world to contribute to the well-being of others as well. Mm-hmm. So
yeah, I see a lot of middle-aged and seniors, right? Whether it's for disease states that we've discussed or simple orthopedics, and because I love seeing my clients and I love what I do, the whole time we're talking, I'm listening, right? So sure, I'm speaking to them and I'm asking questions, right? Because I do anti-aging, right? Because everything I'm talking about today is part of anti-aging. So when somebody comes in, I'm talking to them about what are you doing now? What did you do? And what do you see yourself doing in the future? By the time we're done, we're nearly friends, right? So not like we're going over each other's houses and sharing a meal, but that client trusts me, and better yet, I know about them because they told me the truth. So when when you practice that way and you take time to listen versus, hey, your insurance only pays for 5 minutes and we're at 4. And they turn their back and they just start typing or dictating, right? So that's not healthcare. And the way healthcare should be is that providers should have time, providers should be able to listen. And if you're not doing both of those things, I personally think you're giving the client the least amount of actual care that is allowable, period.
Yes. And I think those insights are a great note on which to conclude our virtual Enlightenment Salon today. Thank you so much for joining us, William, and sharing your wealth of knowledge as well as your philosophy of healthcare, which I think is very much one that more medical practitioners of whatever treatments, of whatever fields should adopt. So thank you. I wish you and Odin Stem Cells all the best, and I hope that we can all live long and prosper.
Absolutely. Thank you very much for the invite, and thank you to the panelists and everyone that joined us with your great questions today.